I understand we are running 10 minutes late, so let's go right into it. Let me just introduce my colleague, Jenni Kirkwood, who is a principal and leads financial wellness at Mercer. So I'm really thrilled to be her support act today. And I'm Wolfgang Seidl, and I lead workplace health consulting in Mercer, and I'm my partner there. And we have only been given 20 minutes between us, so we decided to talk to you about consolidated models of well-being. And we sort of said it is the better way of achieving results. And we will want to prove to you the ROI piece and the outcomes of such a consolidated approach. But as I said, we only have 20 minutes, so I decided I will talk in a German accent today because that always sounds very efficient and will hopefully take us through a little bit faster. And Jenni promised she will talk about financial wellness in a Scottish accent, so make of that what you will. Very quickly, how do we conceptualize health and well-being? We identified at Mercer 8 dimensions of well-being here. You will be familiar with physical and emotional health, or mental health, as others would call it, and social health. But there's so much more to it. And there is, of course, financial well-being that Jenni will be talking about. And there is, an intellectual challenge that people need at work. It's also about occupational well-being. It's about working in an environment where your line manager is empowering you, as opposed to indulging in a toxic boss syndrome. We don't have time to go into that now, but over time in the conversation that will come up. So just over to Jenni for a second.
Okay, so by financial wellness and well-being, and the two of those names kind of get used interchangeably, well-being, I mean being on top of your finances. Quite simple, quite straightforward. That's what that one means. So I want to kick off with some Slido questions to make sure everybody's back engaged after their coffee break. So, what proportion of UK adults have less than £100 in savings? So if you could get your Slidos out and start answering that, and if we could put up the numbers as and when they come through, that would be fantastic, Beth. Okay.
Still changing their minds?
Yes.
Good.
Okay. Actually, the situation is a little better. You are a very pessimistic audience. It is 30%. So that means 17 million UK adults are one broken boiler away from financial ruin. And over to our second question, which is mental health related.
Yeah, mental health related question. What proportion of employees feel able to discuss their mental health with their line manager? Please vote now. Okay, many of you have read my BITC report and paper on that one, because it's a shocking 11% only, isn't it? So that speaks to the stigmatization of mental health. And it speaks to what Jenni and I are discussing today, because of the scarcity of time, we decided to particularly focus on the link between financial wellness and mental health. Mental health is almost a link in this case to physical health and social health, etc. So we shall be talking about that later. So now, just to throw a few more data sets at you, if I may, I want to remind ourselves of the data we have found over the last 5 years in Britain's Healthiest Workplace. Most of you will have seen it. It's published in the Financial Times, and it talks about the status of health of employees in the workplace. And and calling it a health age is just another proxy for your status of health. And what we find there is that UK PLC, based on their health status, is about 4 years and 2 months older than their chronological age. So that is sort of a proxy for well-being. And the usual suspects apply as courses for that, you know, and it's about nutrition, it's about body weight, it's about lack of exercise, all the rest of it that you're familiar with. So because we have so little time, I want to refer you probably most to what you see at the bottom left. And if we now frame it from a financial wellness point of view, if you imagine somebody having financial issues, and this seemingly low figure here is referring to severe financial worries here, please. And what would happen to them? They would obviously be stressed, and if you are stressed, you would be sleep deprived, and if you are sleep deprived, you would wake up the next morning with those all too familiar carbohydrate cravings and eat the wrong type of food, which in the long term may predispose you to diabetes type 2, one of the biggest ticking time bombs in the UK. 850,000 people don't even know they have it, and it has a big impact on productivity if they are not being treated. So what that example is trying to show to you is that why Jenni, when she submitted the paper, called it a consolidated approach to well-being. Because that means now with that one little example here, that case vignette bottom left, we have talked about financial wellness, we have talked about mental well-being, we have talked about physical well-being, another component of our 8 dimensions, and we of course talk about cognitive health, because if you are sleep deprived, it's very well known that cognitive functioning is impaired to some degree, and we have talked about physical health in terms of potential for diabetes. So you see, it's a sort of all coming together here as a model, and we might say that one more time later, that if you don't use an integrated approach to health and well-being, you run the risk of doing something that I call squeezing the balloon phenomenon, right? You focus on absence and you get more presenteeism, for instance, or you focus on one element of the story and you get more on the other hand. You might focus on mental health and then you get more back pain because there's an overlap as well. So our plea is for a strategic approach. Last but not least, bottom right, you see what does it do to productivity. It's 30 days on average that we lose on productivity if you look at absenteeism and presenteeism together. And we have good academic organizations like Cambridge University computing and supporting the numbers that you see in front of you. And what's the scope of the opportunity? If you look at Britain's best companies, they would have 10 days less of lost productivity. So there is an opportunity for us realistically of winning back 10 productive working days. So that's our return on investment opportunity realistically. Now, we said the biggest link we want to focus on today is mental health, because it's a really clear link to financial wellness, as Jenni will point out later. And secondly, it's convenient for me to talk about it because I'm a psychiatrist. So there is many reasons to talk about it. And that slide, actually, that's a photograph I took in the Tate Modern. There is the Picasso exhibition on at the moment, and he calls that painting the rescue. And I thought that's like mental health, the rescue. What do I mean by that? We have run a lot of campaigns now in the city to destigmatize mental health, and that's wonderful, and that helps facilitate culture change. But it has made no impact whatsoever on the numbers yet, I'm afraid to say. PITC survey that you obviously read so carefully says 60% of employees are indeed encumbered by mental health issues associated with the workplace. So it hasn't achieved that yet. So my key point here is, if we took a very strategic and very pragmatic approach to mental health, as we do to musculoskeletal disorders, and create some very down-to-earth pathways, that will have a much bigger impact on destigmatizing mental ill health than anything else. And we will provide the figures later on when we talk about ROI.
Financial wellness is another area where there's a lot of stigma around it. Surprisingly enough, people do not talk around the water cooler in the morning and saying, I spent the weekend shifting money between my credit cards because I was running out of the interest-free period on one and had to shift to another. You just don't talk about it. But people are worrying about it. Our 2018 Global Trends Survey found that people on average were spending 10 hours per week at work worrying about money. Now, that doesn't mean to say they weren't working at the same time, because they were, but they were not giving their full focus. And the figures we've got down here, about 33% just about managing financially, 26% relying on credit cards. Just want to kind of note that people would normally think, oh, automatically that's a lower paid issue. It's not. The debt ratios continue right the way through, up from low salary to high salary. Kind of roughly 50% of people have significant non-mortgage debt. And another kind of quite surprising statistic is that over 10% of people earning over £100,000 can't pay their credit cards off. So if you have more, you tend to spend more. And the thing I wanted to highlight here is half of British adults with financial difficulties also have a mental health problem. So if you look after one side and look after the financial health, then it will have a beneficial effect on the mental health, but you need to do the two together.
Thanks a lot. So how do we bring it all together? I mean, we have sensitized you now to the problem, and I know you know the numbers anyway. How do we bring it all together? So that Workplace Health 2.0 model that I sketched in a presentation last year has developed very much further now, and Jenni and I have jointly delivered to clients and can give you the results in a moment. But let's focus on that slide purely on the data sets first. We believe that only a data-driven and insights-driven strategy will ultimately pay off. And what data sets do we need? We talk about health data, and they are to do with the one-sided information you get if you only look at PMI data or only at long-term disability data, or if you look only at absence data. They all tell a different story. So we need to really bring them together in form of a dashboard. But that's not enough. What we have done since is to start cross-referencing this data set against your demographic, and particularly do justice to the D&I situation in your organization and performance related to that. So what do I mean by that? If you imagine a young woman entering the workforce, gets a great performance review, we want to know what does that do to her health a few months later. Or a young man becoming a father for the first time, what does that do to his health a few months later? So this intersectionality of the various aspects of diversity and inclusion create an individual, and we want to communicate with individuals as best as we can. And the most forward-thinking benefits experts will talk to you about an audience of one as the direction of travel. So ideally, we want to sort of individualize and personalize what we are communicating to our employees. And to just then when you look at all the other items that we have on that slide, they are just pathways to respond, because finding the issues, finding the data is just one thing, but the so what question needs addressing. Whether it's a mental health pathway, a musculoskeletal one, a maternity pathway, an on-site clinic, that then just follows. And the same goes for D&I. Men and women perceive healthcare very differently. Different ethnic groups have different propensities towards certain types of diseases. Why are we still communicating in a one-fits-all type of fashion? And to bring it all together, let me just quote you one example. I often talk about the transport industry because you see big absence rates there, right? I was talking to a company, 5,000 employees, who had 1,000 employees off at any given time. And I mentioned that in a speech to over 100 risk managers, and something fascinating happened. One lady who is an HR director in transport industry stood up and said, I have seen exactly the same data as you. But when I started following D&I principles, as unintended consequence, when I had reached 40% of female drivers, suddenly absence rates halved. What does that tell us? Women are better at addressing their health issues early and also helping their male colleagues get over their experiences of traumatic events in the industry. Because what I didn't say to you, but all of you know probably, is that working as a train driver, for instance, can be very traumatic because people, use the tracks to commit suicide and so on. And there seems to be a tacit understanding that if you stay home for 3 or 6 months, it will help you back into work. The opposite is the case. So I just wanted to bring that example to illustrate the D&I aspect of it.
And in financial well-being, I mentioned earlier, it's being on top of your finances. Rewards programs to date have really concentrated on the long-term goal. If we all look at our spend, what do we spend it on? Pension. It dominates everything. But really, there are in our view, with this research we've done with Professor Benazzi of UCLA, there are 4 aspects to financial wellness. The first being in control of your day-to-day finances. The second, being able to cope with a one-off shock, the boiler breaking. Being able to make short-term gains, short-term choices, so that's going on holiday or just little treats now and again. And then also the being able to do the long-term goals. Now, as I said, to date, we've been concentrating on number 4, 1 to 3, which is arguably where most of our employees are bothered about, has not got that same level of attention. And I could have cheered earlier when Professor Grattan said that generational stereotypes, a load of rubbish. I agree wholeheartedly. If you line up, 5, 6, 40-year-olds, you'll find different needs, different wants. And so therefore, that's why when we're looking at developing programs, one size does not fit all. Targeting people based on age and sex does not work. We all have different needs, so we need to develop programs which allow people to access what they need when they need it. Wolfgang was mentioning about data is at the heart of this all. We use data at the start to try and target a program accordingly, and we need it at the end to actually work out whether our program has actually worked. So you need to understand your workforce, and from the data that we have, you can draw insights from that workforce data to work out what is it that my employees are going to value. Then we can then put it together in a simple dashboard, at which point I hand back to my colleague.
Yes, I have mentioned the dashboard before, so I won't go into it now, but if you wanted to pick one up at our stand, you can. But those dashboard insights are really what should drive a strategy as opposed to anecdotal evidence. And then the most interesting part is how do we facilitate behavior change? The second biggest holy grail in health and well-being management, one being ROI, the other one behavior change. And as Jenni was saying, it's a lot to do with the research that Professor Benazzi has done, or Mercer also liaises with Stanford University on behavioral economics. So we want to know really how can we facilitate behavior change. And some of those insights come, of course, from personalized financial statements, which we will be mentioning to you in a moment as well. But also in Britain's Healthiest Workplace that I showed you to begin with, we always ask people, how motivated are you to change? And they say, yes, I want to lose weight. Yes, I want to exercise more. I want to eat the right food. But nobody says, I want to decrease my alcohol intake. And you saw it was quite significant. It was nearly 30% above recommended limits. Isn't that fascinating? So then you know where to target your interventions. And what can I say about ROI? Let's spend the whole day on it, please. It would be so much fun. But for the purposes of this session, we can just say, ROI doesn't have to be rocket science. But also it can be calculated. So if people think it is just airy-fairy, that's absolutely not true. You can calculate ROI and outcome measurements. I'm a big believer in measuring not just financial outcomes, but also clinical outcomes. If what we are doing is not evidence-based, so why are we doing it in the first place, and why are we dreaming up some sort of ROI that wouldn't apply then later on? So you see here the ROI variables that are highly relevant here, and I go quickly to my last slide because people are showing me that we are coming up to the end very soon. And the data here is compelling. So that's a joint project between Jenni's department and mine. And what Jenni found is that when she uses personalized videos, she helps people much better apply the theory of financial savings to themselves, and found an increase by 33% of members paying into their pension funds. So that's 1 in 3 that responded to personalized videos. We need personalized approach also in healthcare, and medicine is moving that way, and we need personalized approach in benefits management, as I mentioned before. If you now look at that link to mental health that we mentioned, then you find quite impressive figures here of 13% of reduction in total cost of claims and 16% in average cost of claims. That's significant if you have a healthcare trust, so that would have an impact on what it costs you. But most importantly, I would say, it also led to 41% reduction in absence rates. So people are getting better sooner, and even more important than that, we saw an improvement of clinical outcomes by 60%. So on that happy note and exactly on time, thank you.